Hi, I'm Andy here. I've been sick with a very bad skin infection. I'm going to go back to that skin infection for you guys to see. So here's my skin infection that I have. This is on my right inner thigh. I blacked out the personal area. Look how gross that is. This was a picture on September 24th. If you notice, the area that on that picture is gotten a lot larger on the current picture. So this is my current doctor. Dr. Charles discharged me. I got a little frustrated because why bother going to a medical doctor if you don't have your needs being met? Previously, you saw a video of somebody that was in pretty bad shape. Not as bad as me, I would say we're probably equal. However, he was a dementia patient. I have autism. I'm going to get to what is a proper discharge with somebody with autism, because autism is technically a cognitive impairment disability. It affects the ability to be able to function independently. And this is what my doctor had given me, a discharge, and it's because I'm not getting my needs met. It all stems from this hospital where I was discharged from. Sean Campbell, the Dr. Charles nurse practitioner, was extremely upset, I feel, at my being discharged. First of all, they don't have half of my allergies listed here. So this is what my discharge papers included for when it comes to my taking care of myself. I am a diabetic. I also have been not feeling good at all. Been really not feeling well. I'll give you the rundown of my symptoms while I'll share you with this. My skin infection was smelling really, really awful. And it was also where I was getting trouble breathing. I was having hives, or shivers rather. I was cold, freezing 1 minute, shivers, shivering to the next minute, hot, sweaty, and just couldn't take it. Then I was very tired. That's why I'm up at this time trying to do this recording for you. Then I had stomach pain, still have it. My lower kidney areas in the back were bothering me. Dizzy, nausea, GI bleed, black stool / GI bleed. And I've been having a hard time being able to get my medications. I think from when I had last talked to the pharmacist at Brian Egger Pharmacy, they pretty much had summed it up, and I'd love to share with you guys is Erie County Adult Protective Services pretty much said, no, we're not paying for this stuff. There's only $40 left in this account. We can't afford it. And the sad thing is, I owe money. They didn't even cover the past due balance. They kept accumulating it. They said no to the over-counter medications. They said no to a lot of my medicines. And then when Andy had called my primary doctor, APS then came out on that Monday, or last past Monday, and they did a welfare check, and I told him, hey, I want to talk to my attorney before you be able to see what I have prescription-wise. And I'm going to show you. So here's an over-counter athlete's foot medication. Here's my brand new albuterol. Here's my migraine medicine. There was 2 boxes, so I only showed one, but there's actually 2. This is my Tylenol. This is my vitamin D3 that I just got. There's a pill bottle. Here's my melatonin that's been for a while. This is actually supposed to be 10 milligrams. However, Walmart was out of the 10 milligrams, so they gave me the 5 milligram. I don't know why I didn't show you the inside, but it was very hard to tell. It's about maybe a week left. This is my doxycycline. Oh, there's my melatonin. It's very hard to tell, as you can see. It's not that many in there. This is my stool softener. Think that would okay. This is my doxycycline that was out for like a week. Didn't get into the other day. This is my stomach medicine for my GI bleed. This is my iron. This is my allergy medicine. This is my adult fiber gummies. Allergy for my meltdowns and anxiety. This is my Demesa nose spray to help me for my allergies. This is just a Tylenol extra pill bottle. This is my what's called levothyroxine. This is my clindamycin gel. This is a conversation that I want to share with you. A part of it from Juice with my doctor, Sean Campbell, the nurse practitioner, and then the other part. However, I'm going to tell you right now, I already knew I'm being neglected. I already knew I'm being self-neglected. Neglected my own needs, that is. I already knew there's emotional abuse by APS, how they just don't understand what I'm going through. However, I'm going to push a little bit on Monday with Juice. I like Juice a lot. Going to ask her, I'm going to push her buttons a little bit. And Juice, if you're watching this video, I don't mean to put you on the spotlight here. But I'm going to show you this is not what you need to do. You don't question somebody's ability to take care of themselves. And I'm going to show you guys another video I want you guys to hear.
We're going to have to do systems. The systems are going to have to pick up because...
Right, why is he going to Niagara County? Why the transfer to Niagara County? That's the one thing you told me is going to happen, but you didn't say why. I'm just curious. APS.
Okay, so here's a summation of what happened, Sean. I've only been working with him since end of July forward. One of the things...
I'm going to actually be able to put more words than what I just did there, okay? Adult Protective Services has seen me for, I don't know, for the last 5-6 years. They've been referred by Sean Campbell and Dr. Jane, his previous doctor, and my previous doctor. Dr. Sean Campbell worked for Dr. Rajiv Jain at Sheridan Medical Group. That's where I met him. That's why I went back to see him. I also was in, seeing him and Dr. Jane. They referred him Adult Protective Services a few times. So did Horizon Health Services. There is a conflict of interest in a lot of this because I am going through a really hard time. Okay? Because Adult Protective Services has never once came out and said, hey, you need help. They never once helped me. They always said, oh, you're the abuser. That's the way my mom and dad talk about me. My mom and dad play victim. I don't really think it's appropriate what they've done to me. My family. I'm going to leave that personal for it right now. However, I do have additional phone call recordings of my telling them, when you tell doctors, social workers, counselors, how I can work one day and not the next, without telling them the reason why I can't work, because Andy's told I need a group home first, before going back to work. They don't tell you I got my learner's permit going against medical advice to please my family. They don't tell you the difficulties me paying attention, understanding a street sign of, for example, you're driving down, for example, Niagara Falls Boulevard. You're going 45 miles per hour. You see a sign, a regulation sign that states speed zone ahead. The speed drops down to 40 miles per hour. I'm like, Dad, what was the speed I was supposed to go? He doesn't want to tell me. So Andy's like, Dad, I'll go down to the bare minimum speed limit, 30 miles per hour, until you tell me what the speed I'm supposed to go. And he doesn't tell me still. He does a smart ass remark. Pay attention next time. I blow stop signs. Because it doesn't really register with me. I know what the word stops means. You stop. However, it got me confused a lot of times because I had trouble identifying that, because in school it was a feeling emotion for when I had trouble with my meltdowns and behaviors. It was my help sign. And he also had issues with knowing where the person's going to go, whether they're going to go that way, this way, or it's their turn or my turn. If they're going to play chicken with me, I'm going to play chicken with them. However, I never got in an accident. Never once got a ticket. However, law enforcement has told my dad over and over again it's not a good idea. The other issue is, you have law enforcement involved with this. City of Tonawanda Police has pretty much told a lot of people, and I've heard this over and over again, would not be surprised if they have told my APS workers that then got trickled down to other people. Because I'm going to show you in a few minutes another conversation that should not be done by a detective during an issue with the November issue. However, I don't know if I'm going to be able to put it out on this channel because maybe I will. Maybe I will make it public. I will then show you guys some of the living conditions my parents had. Some of the other issues I had when trying to get services. I'm called a fake. Social media calls me a fake. You know why? It's law enforcement, the public, social workers, combination of doctors, combination of APS in Erie County. I would love to play this a little bit further. Because I am not faking. I'm not fraudulently misleading my symptoms. I have trouble. And nobody's really done the assessments that should have been done.
That happened is there became a conflict with APS and Andrew. Part because they thought...
Okay, we're going to go back here. I'm going to just put more into this. When APS was all last year, they were trying to use a schizoaffective disorder diagnosis in Erie County. However, doctors at hospitals, my own doctors, they were saying, no, it's autism. But then they were calling me malingering because of, they claim my symptoms were forged. I'm not malingering. I don't know why I'm malingering. I don't know what is faking, what you think I'm faking about. I just need help. And I'm not getting help. I can't have a counselor. Can't have services that I need. And here, it's because all these people claimed I don't have a mental illness. My last counselor had me scheduled an appointment for my psychiatrist after getting out of Niagara Falls Memorial Hospital with Klonopin 0.5 milligrams twice a day. Saw the improvement. Jennifer scheduled a nurse practitioner visit, not a psychiatrist, which is required for this, but had said, hey, he needs medication. My appointment was the second day in September, where I had been apparently my doctor's appointment was supposed to be by phone call. Nope. They wanted me seen in person. They never told me that. They never once told me that. My counselor said, it's going to be phone call. They're going to be calling you. Be by your phone. And he was by my phone. Apparently, I called them. Like, why is the doctor not calling me? They said, well, we had to schedule your appointment because you were supposed to be here. And then he's like, I'm supposed to be there? Was supposed to be by phone. They then had said, okay, we'll schedule your appointment 2 weeks out. Well, that week, didn't realize I was discharged from Best Self. So I called up asking them why. They said they don't treat autism. There's no medications for it. There is no, you need services for your autism, a group home. We don't have any options for you. However, your behaviors, your anxiety, what you claim as depression is all related because of your autism. Follow up with your primary care doctor. During this time, I didn't have a primary care doctor because issues of my needs not being met. I don't even understand what happened with that counselor or doctor at Elmwood Health Center, other than he treated me at Kemah Mercy, and then I got discharged from, there was an issue with the malpractice at Kemah Mercy, so I think there was a conflict of interest for him being even involved in my care. Fast forward to today, I'm in the same boat. No counselor, no doctor, no psychiatrist. But I'm also being told APS claims, first of all, APS cannot hold a truth. You can't lie by changing your story all the time. It's either you don't need diapers ever before, you don't need diapers 3 years ago, or you don't need diapers 4 years ago. You can't have all three. You can't tell me never once don't need help, but yet I'm incompetent is what they deem me. If I'm incompetent with my decisions, then why don't you do something about it to get me help that Annie needs help? Because you won't. That's why. If someone's incompetent, you pull what's called the Involuntary Protections Act, or Involuntary Adult Protective Services Act. You get a court order called Adult Vulnerable Protection Act. You force placement, whether OPWDD, OMH, skilled nursing. You do one of the three. Nobody's done this. I've been battling APS. It's been a hell. It's been a nightmare. I think some of the influence came from APS listening to City Tonawanda Police. I would love to hear transcripts on that, because it is my understanding they were a lot of collaboration, especially the November issue. APS claims I was given 3 group home placements and I walked away from additional one. Well, was never offered one. I'm called a faking, fraudulent, misleading my diagnosis and my conditions. And I would love to play this part.
There became a conflict with APS and Andrew, part because they thought he was manipulating information, misinforming and misrepresenting his condition. And part is because there was a personal conflict because his approach to communicating to people wasn't always nice. And then the last part is his recording and suing and threatening, creating. The situation that we have currently is that we can't get him meds.
This is in the Mill Fillmore Suburban Hospital.
By standard scripts. Because, in simple language, there was some financial problems between APS managing his money and the medical and hygiene and products he needed. So, in simple language, they misappropriated and mismanaged and miscommunicated to him how budgets work. He can't get medicine because when the nurse came in, it's like, so can you go get the script, what pharmacy, whatever else. We don't have the ability to get access to medicine. But it's not just this. This isn't his only medical concern. It's about diabetes too. It's about.
I don't have a test kit, and we're help testing the sugar.
And the litany for medical neglect provided by the agency of what is supposed to be helping and supporting him from the Department of Social Services and the Adult Protective Services, the system that is supposed to support him has not and will not. So the problem that I have is the only solution I have is a medical admission for medical neglect, self-neglect, and this deterioration. Like